Today, we have a story to tell, and it happens to involve this little guy. Oh, that's just the centrifuge just finished. Happens to involve this little guy. For those of you who don't know him, this is George. George is an English toy spaniel, and he's 15 and a half years old. We adopted George when he was about a year and a half old, and he came from a very large puppy mill in West Virginia. So he was meant to be a breeding dog at this puppy mill. The puppy mill got closed down. And interestingly, the puppy mill was owned by a man who had the top English toy spaniels and I believe Papillons at Westminster. And then he kind of lost his mind and decided that 500 dogs was better than 10 dogs. And he got turned in and closed down, thankfully. And George got released to what I consider to be a wonderful life. So he came through Lucky Star Cavalier Rescue because they are one of the Cavalier Rescues who are willing to also rescue and adopt English toy spaniels. And as much as I love the Cavaliers, the English toys really have my heart. And so we also have Gabby, who's an English toy spaniel. She's our Ruby. And we also just adopted Gilmore, who is a Blenheim English toy spaniel, who also came from a breeding/hoarding situation. So we've had George since he was a year and a half old, and he had really severe dry eye when we adopted him. And it was 14 years ago, and I was pretty early in my holistic career and my TCVM career. And I decided that when we got George that I could cure his dry eye by making a diet for him. And so the dry eye diet that you've seen published in my books and on our website was designed originally for George, and it's gone through a few iterations. I like the current iteration the best, but even the original one that I used that was in the first book, From Needles to Natural, it solved George's problem. And within 3 months, he was able to be taken off of all of his dry eye medications. At that time, he was on cyclosporin, which, now I much prefer tacrolimus in MCT oil. But he was able to be taken off all his medications, and his dry eye was completely healed just with a diet change. So that right there showed me the power of food therapy. And I was really, really hooked. So little George, being an English toy spaniel, has a lot of the problems that we see in the breed. He has COMS, which is caudal occipital malformation syndrome, where the back of the skull presses into the brainstem, and part of the brainstem is on the outside of the skull. He also has SM, which is syringomyelia, which are fluid pockets in the spinal cord. And some of his are actually fairly low down on his spine, so sometimes he'll chew at his sides. He also has intervertebral disc disease in his neck. He's had a couple of MRIs. That's how we have proof of what has happened with him. The first MRI he had because we came home one night and he was screeching in pain, which was secondary to the discs in his neck, the COMS and the SM. Got him through that episode. And then a couple of years later, he developed paralysis of the left side of his head and face. So his tongue hangs out on the side, his lip is drawn up. He cannot blink. He's a black dog, so it's impossible to see on camera, but he can't blink his left eye. And that's been going on for at least 5 years. And so the problem with not being able to blink is that he can't spread tear film across his eye. So it's basically the same as having dry eye. Even though he does produce tears, he can't spread them across the eye surface. So for the past 5 years, I have been, me, my mom, everybody, we've been putting drops in his eyes multiple times a day. So he is back on tacrolimus because I want to make sure. He also has a little bit of pannus, which is a black film that will grow across the eye when it dries. And because he can't blink, he does have some drying of the cornea. So we use hyaluronic acid eye drops. We use an antibiotic eye drop because he also developed MRSA in both of his eyes from the chronic issues. So we're on about our 4th different antibiotic drop, but it's keeping it very well under control. So he has the tacrolimus, the hyaluronic acid eye drops, and his antibiotic eye drop. He doesn't see great, but he sees enough to get around. So we're very happy with that. He's 15 and a half years old now. He's mostly deaf. he hears some things. Like if we clap loudly, he hears that. If we get really excited and call him and, you know, loud and animated, he hears that as well. So a few months ago, George started doing a lot more panting, and his tongue, Joey, for Facebook and Instagram, we can put that picture up. His tongue became this dark, toxic red. Well, you stop panting now, so Instagram isn't going to see it, but good for you for not panting for a minute. So in Chinese medicine, we use tongue color to tell us a lot. And there is a darkness that occurs when we have a deep-seated heat problem within the body. So a few months ago, I started saying, George, there's the good one. George, your tongue is toxic red. Something toxic is going on inside this dog. And I took him in February of this year to have a dental cleaning done. We did lab work and chest x-rays prior to that because he also has mitral valve disease. He's not on medications for that, but he is stage B2 with a grade 5 murmur. So he's not on medications. We manage that with diet and supplements. And so before his dental in February, he had lab work, which was pretty normal. Kidney values were good. His BUN was a little bit high, but nothing that was concerning at all. And everything else looked great. And his chest x-ray looked great. So we said, okay, that's awesome. He's had 2 echocardiograms done and doesn't need medication. He's also had annual abdominal ultrasounds because he has a history of stomach ulcers, because he's our little nervous Nelly, because he's kind of low man on the totem pole. So when the toxic tongue showed up, I said, something is going on with this guy, and I don't know what it is. Well, all of his lab work came back fine. His chest x-ray came back fine. This is when it becomes a search and destroy. What is going on? Where is this toxic heat coming from? He also he's on a raw diet, so he's a very high moisture diet. He started drinking more. And I said, he's trying to put out the fire. There's a fire in this dog somewhere. Now, our boys wear piddle wraps in the house. Forrest is not neutered. He's a young boy, and he still likes to mark. George has always been really good, but he started having accidents. And I said, you know what? I'm just going to wrap you too. Maybe you're having accidents because Forrest is having accidents. And then about a month ago, I started finding little pee spots in the house. And we couldn't tell. Now, Charlie, if you remember, our Cocker Spaniel that we adopted in January, has some small oxalate bladder stones. So we're keeping an eye on that. They're not bad enough that he needs surgery at this point. But my question at the time when I was finding these little urine spots, I was putting dipsticks in them and they had traces of blood, red blood cells, but the pH was low. So not an infection. And I thought, well, okay, Charlie's having little accidents from these stones. Maybe they're trying to pass. Couldn't really tell what was going on. And so this went on for a few weeks. And finally, we figured out that we thought it was George who was leaving the little piddle spots, like when he didn't have a wrap on. And we also noticed that George would be standing in the house, and you can tell when he's peeing, he doesn't lift a leg. He just stands in the middle of the room. The tail comes up and the body kind of does this. And I said, oh, he's getting senile. He's peeing in his wrap. Like, I don't think he understands where he is. Well, we started putting all these pieces together, and finally I said, you know what? I think this is George's urine, and I think it's got traces of blood in it, and that's not normal, and we need to figure out what's going on. So first thing I did is I took in a urine sample. So it took quite a few days to get the urine from him, because when I go near him with a cup, he runs the other way. So the urinalysis came back with slightly concentrated urine, so that's good. The kidneys are still doing their thing. Normal pH. Tons of what the dipstick was reading was white blood cells and red blood cells. So I said, okay, let's drop off a sample. And when I dropped off the sample, they came up with the same exact thing. Lots of white cells, lots of red cells, and epithelial cells, which are the cells that line the bladder wall. And I said, oh boy, this is not good at all. So my veterinarian called me with the results, and she said, well, it looks like he might have an infection because we have red and white blood cells. And I said, it's not an infection. The pH is normal. not an infection. I'm really concerned he may have a tumor in his bladder. So I said, I want to schedule him for an ultrasound as soon as possible. Good boy. So she agreed to do that. In the meantime, we got lab work on George. So we did a complete CBC and chemistry and thyroid panel. Good boy. You want to get down? You can get down now. You're such a good boy. There you go. Go play. So we got his lab results back. Red cell count normal. White cell count normal. Normal distribution. Platelets very mildly high. 464,000. Normals up to 448,000. All that tells me is there's a little bit of inflammation somewhere. Woohoo. On his lab results, his SDMA, which is kidney function, came up at 16, which it had been a year ago, and then it dropped down to 12 in February. It's back up to 16. Cutoff is 14. That doesn't bother me at all. Creatinine for kidney function, 0.9, perfectly normal. So I know that his kidneys are doing what they need to do. BUN was elevated at 44. Well, could be that he's on a high-protein raw diet. Still not concerned. I know he's not in kidney failure. The rest of his lab results are normal, except for his ALK-Phos, which is a non-specific enzyme that can come from steroids, from the bone marrow, which I knew it wasn't that, or from the liver. His other liver enzymes are perfectly normal, and his ALK-Phos is 203. Normal's up to 160. Again, nothing earth-shattering. I'm like, okay. Oh, and creatine kinase, 295, normal's up to 200. Well, that's a muscle enzyme. He's got muscle wasting. He's losing weight. And he has a heart problem. So slightly high CPK, no big deal. So again, I've got lab work, and this happens so often. I've got lab work that doesn't give me a real answer. So I knew that the next step that I needed was an ultrasound. So our local veterinarian, Dr. Foka, who I had on about a month ago,